Hello everyone, welcome to my YouTube channel Nursing Education. So today I'm going to explain about few questions of midwifery NMC CBT examination. Question number 1, define the term holistic care. Choose the correct answer. Option A is addressing legal, social, physical, psychological and emotional need. Option B is addressing emotional, legal, social, economic and physical needs. Option C is addressing physical, emotional, social, spiritual and psychological needs. Option D is addressing economic, social, legal and spiritual needs. You can stop the video and answer the question and then see the answer in the upcoming slide. So the correct answer is C. Holistic care address physical, emotional, social, spiritual and psychological needs. Question number 2. What are the key human rights principles? Option A. Dignity, fairness, equality, respect and independence. Option B. Fairness, equality, independence, love and care. Option C is dignity, fairness, compassion, love and independence. And the option D is compassion, love, independence, respect and equality. The correct answer is option A. The key human rights principles are dignity, fairness, equality, respect and independence. Question number 3. Explain what is meant by authentic communication. Choose the correct answer. Option A. Talking over people when they interrupt. Option B is listening to react to what women say. Option C is listening and being open and honest with what you say. Option D is being honest and frank when giving information. So the correct answer is option C. Authentic communications is listening and being open and honest with what you say. Question number 4. Explain the term duty of candor. Option A is being open and transparent when things goes wrong. Option B is telling a colleague not to pass on information. Option C is being direct and defensive when things goes wrong. And option D is covering up mistakes when things go wrong. So the correct answer is option A, being open and transparent when things go wrong. Question number 5. How do midwives use reflection? Option A, to develop professional boundaries. Option B, to develop professional knowledge, understanding and skills. Option C is to advise women about evidence-based practice. Option D is to develop a curriculum vitae CV to use when applying for a job. Correct answer is option B, to develop professional knowledge, understanding and skills. Question number 6. Evaluate the term informed consent. Option A, to provide information in several formats. Option B, carrying out a treatment or action because it is in the best interest of the woman. Option C is to provide sufficient medication for effective treatment. And option D is receiving sufficient information in order to make a volunteer decision. The correct answer is option D. The informed consent is receiving sufficient information in order to make a volunteer decision. Question number 7. What is the primary aim of continuing of care? Option A, to provide sufficient medication for effective treatment. Option B is to addressing women's health needs in her antenatal appointment. Option C is to address women's physical and emotional needs. And option D is to address women's health needs over a continuum of time. So the correct answer is D. The aim of continuum of care is to address women's health needs over a continuum of time. Question number 8. How does a midwife ensure a woman who is breastfeeding receives the appropriate support? Option A. Refer to the health visitor. Option B. Coordinate care across multiple agencies. Option C. Give her the number for a peer support worker. And option D is observe a full breastfeed. The correct answer is B. Coordinate care across multiple agencies. Question number 9. Why is it important to consider women's social need? Option A. Helps the mother to breastfeed exclusively for 6 months. Option B. Enhances women's ability and confidence to improve long-term maternal and child health outcomes. Option C. Ensure the child communicates to build social relationships. Option D. Enhance the mother and partner's intimate relationship. The correct answer is B. We should consider the woman's social need to enhance women's ability and confidence to improve long-term maternal and child health outcomes. What priority does a midwife give to a woman who is unable to access services? Option A. Scheduled appointments at the same place and same time. Option B. Report her to social services of failing to safeguard her child. Option C is individualized and flexible appointments to suit her needs. Option D is financial support so she can use public transport. The correct answer is option C, individualized and flexible appointments to suit her needs. Question number 11. What is the meaning of epidemiology? Option A. The branch of midwifery concerned with promoting physiological process. Option B. The branch of medicine relating to incident, distribution and possible control of disease and other factors relating to health. Option C is the branch of medicine concerned with the study of cause, prognosis, treatment and prevention of diseases. Option D, the branch of medicine that concerns the study of gynecological health. The correct answer is option B. The meaning of epidemiology is the branch of medicine relating to incidence, distributions and possible control of disease and other factors relating to health. What happens if health information is available only in written format? Option A. Parents are able to keep the information with them at all times. Option B. Lack of informed decision making and contribution to health inequalities. Option C is midwives are able to show they have given information to parents. Option D is lack of control over birth and health choices. The correct answer is B. Lack of informed decision making and contribution to health inequality. Question number 13. Why is safeguarding important for the protection of public health? Option A. It enables people to overcome their personal difficulties. Option B. It enables people to live their lives as they choose. Option C is it enables people to live free from harm, abuse and neglect. Option D is it helps the midwife to carry out their role effectively. The correct answer is option C. It enables people to live free from harm, abuse and neglect. Question number 14. How are positive family attachments described? Option A. When a mother responds to her child's needs every time it cries. Option B. When parents do not acknowledge their children's needs or achievement. Option C. The way siblings interact to enhance their long-term relationships. And option D. When parents interact with their children in a way that promotes secure bonding and relationships. The correct answer is option D. When the parents interact with their children in a way that promotes secure bonding and relationships. Question number 15. Why is control cord fraction used in the third stage of labor? Option A. As a part of active management of the third stage of labor. Option B, the mother may be too tired to push. Option C, in order to reduce blood loss. Option D, in order to remove the placenta quickly. The correct answer is option A. The control cord traction is used in the third stage of labor as a part of active management of the third stage of labor. Question number 16. Why is it important to dry a newborn following birth? Option A, to encourage breastfeeding. Option B, to encourage circulation and breathing. Option C is to prevent the baby from crying. And option D is to prevent heat loss. The correct answer is option D. It is important to dry a newborn after the birth to prevent the heat loss from the baby. Question number 17. What is the role of oxytocin during labor? Option A, inhibits contractions and dilatation. Option number B, stimulates contractions which enable cervical dilatation. Option C, stimulates bleeding control. And option D, stimulates breastfeeding and bonding. The correct answer is option B. Role of oxytocin during the labor is to stimulate contractions which enable cervical dilatation. Question number 18. Why is culturally sensitive care important? Option A, builds trust and enables the correct information to be provided. Option B, builds trust and reduces health inequalities. Option C, builds trust between the midwife and the community. And option D is build trust and enables midwives to understand different religions. Correct answer is B. Culturally sensitive care is important to build trust and reduce the health inequalities. Question number 19. How many inflation breaths are required to initiate neonatal resuscitation? Option A 5, option B 1, option C 10 and option D 15. The correct answer is option A 5. Question number 20. Why is it important for a midwife to gain a full understanding of a woman's family history? Option A, to enable the women to make decisions with their families about their care. Option B, to prevent ill health and provide any care, referral and support that may result. Option C, to protect against safeguarding issues and harm. Option D is to provide all the screening and testing required to prevent ill health. The correct answer is option B, to prevent ill health and provide any care, referral or support that may result. Question number 21. How is midwifery care maintained in a complex pregnancy? Option A, coordinate routine antenatal appointments and maintain continuity of care. Option B, ensure the woman is in regular contact with the consultant so she does not have to see a midwife. Option C, coordinate all referrals necessary for the woman's care. Option D, tell the woman the time and location of her appointments. The correct answer is A, coordinate routine antenatal appointments and maintain continuity of care. Question number 22. Define the meaning of an adverse event. Option A, an incident that prevents harm to the person. Option B, an incident where a midwife chooses not to practice. Option C, an incident that results in death. Option D is an incident that results in harm to the person. The answer is option D. The meaning of adverse event is an incident that results in harm to the person. Question number 23. What is a sustainable health care? Option A, filtering resources and discarding unwanted equipment waste while promoting health. Option B is ensuring that waste is filtered into the right categories and bins. Option C is conserving resources and reducing ecological damage while promoting health. Option D is reducing ecological damage by reducing the number of people visiting hospitals. The correct answer is C, conserving resources and reducing ecological damage while promoting health. Question number 24. What is the value of reporting near miss incidents? Option A, to protect staff at work. Option B, to follow hospital guidelines in order to care effectively. Option C, to make sure the family gets compensation. Option D, to prevent illness, injury or damage that may occur in future. The correct answer is option D, to prevent illness, injury or damage that may occur in future. Question number 25. The 4 Ps from the NMC code 2018 are: option A, praise people, practice precisely, preserve trust and promote professionalism. Option B, prioritize processes, practice safely, preserve integrity, promote teamwork. Option C, prioritize health, practice carefully, preserve dignity and promote midwifery care. Option D, prioritize people, practice effectively, preserve safety and promote professionalism and trust. The correct answer is option D, prioritize people, practice effectively, preserve safety and promote professionalism and trust.